Welcome back. It's day 8 of Interstitial Cystitis Awareness Month. If you're new here, my name is Callie. I'm a dietitian that specializes in interstitial cystitis, and for the entire month of September, I am doing one video per day teaching you about IC and also raising awareness for this condition. Today we're going to dive into conditions that are commonly diagnosed with IC or overlap with IC. There are 3 conditions that people with IC also might suffer from. And those conditions are endometriosis, irritable bowel syndrome, and pelvic floor dysfunction. Endometriosis and interstitial cystitis are referred to as the evil twins because of how common they are for someone to have both conditions. The symptoms also can overlap, especially if you have endometriosis on the bladder. The next condition is pelvic floor dysfunction, and that is when you have dysfunction in the muscles of your pelvic floor, which hold up your reproductive organs. And this is really common in people with interstitial cystitis and can actually have symptoms that mimic IC. And some people even get misdiagnosed with IC when they're actually suffering from pelvic floor dysfunction. The third one is irritable bowel syndrome. So this is another condition that is a diagnosis of exclusion, just like IC, and it affects the GI tract. And I'm pretty sure the statistic is there are 1/3 of people with IC that also have IBS, and when having both of those conditions, it's important to know that your organs do talk to one another. So if you have a flare of your IBS, it could flare your IC or vice versa. Here are some other conditions that are commonly associated with IC, and as you can see, many of them are autoimmune in nature. If you have any of these conditions, definitely chat with your doctor. See if they think that, IC is a diagnosis that is on the table. This could really help determine what treatment path you should follow and could just be really beneficial on your journey. In the next video, I will dive into all of the different treatment options for interstitial cystitis.